Now, this session is about using analytics to transform health and healthcare, and it'll be about the power of data, what we can learn from it, and how we can use it to make a real difference. Two speakers, Mark McCrindle, social demographer. Mark speaks at lots and lots of conferences. He's really good. He's an award-winning social researcher, best-selling author, on telly a lot, talking about demographic trends, how Australia is changing, how the workforce is changing. He consults to many leading organisations. He's really terrific, and you'll enjoy his session. Following him, Sarah Thackway, the Executive Director of the Centre for Epidemiology and Evidence in the New South Wales Ministry for Health. She'll come after Mark, and after that there'll be a video of some case studies. But first, give a warm welcome to demographer Mark McCrindle.
Good morning. Well, I have added one word to this title, and that word is visual. I think we've got to use visual analytics to transform healthcare because we live in a visual world. In a world of big data, we need visual data. We are in a world of information overload, and so we have to find new ways of getting cut through. You know, wherever we look, of course, we're surrounded by visuals, and through those visuals we make decisions and are influenced. James just introduced me as a social researcher, but I'm actually a visual researcher, as we all are, because it's the visual cues that influence us and help us make decisions. Famous leadership and management expert Peter Drucker was famous for a quote. He said, "What gets measured gets done." And we believe that in the healthcare system. That's why we measure things, because what gets measured gets done. But I would add one phrase to that for the 21st century. What gets measured and effectively communicated gets done. What gets measured and clearly and visually engaged and articulated gets understood and applied and acted upon. It gets done. And even that term research, I mean, so many of us here conduct research and we look for insights and we analyse trends to foresee where things are going. The etymology of those very words shows us search and sight and see in the very craft in which we're engaged. If you're choosing which cafe or restaurant to go to, you might look at the star ratings or how many likes it's had. We follow pathways and wear marks in the grass to indicate which the more popular direction is. We look at an earmarked magazine to work out, oh, that's more popular than this one. It's a show of hands or the length of a queue. These are the visuals on which we make decisions all of the time. And that is even more the case, the power of the visuals in this world where we carry the visual display device with us, the glass, which is designed not to communicate written content, but of course visual and video-based content at that. We live in the great screen age, and such is the premium of the screens and the visuals they're communicating with us, that the screens are getting larger all the time. In fact, they're getting so big, they used to be called mobile phones about portability. They're getting so large, they're not as mobile as once they were, and it's getting a bit ridiculous. I did find a guy who's got a bit of a forecast as to where it might all be heading if this continues on, so getting a bit out of control. But of course we notice on our devices that it doesn't have a PLAY written there anymore, because the triangle tells the story. And when the technologists invent new technologies, they invent new symbols to go with that, to communicate to a global audience what that button means. And this is true not just in technology, we see it in real estate, in lots of areas now where visuals communicate what words used to. 2 bedrooms, 1.5 bathrooms, 1.5 car spaces. I grabbed this from the inner west of Sydney. It's getting pretty crazy there with real estate that they're bragging about an extra half a car space, but that's the Sydney real estate market. You know, if all we do is communicate content in written forms, we know from neurological studies that the brain has limited capacity in terms of how long it can retain that unconnected knowledge or how many items we can store there. But there are no known limitations to the brain's ability to store and retain visuals. And so the power of visuals is greater now than ever before. Now, this is not to say that written words don't matter. Of course they do, and language and literacy is important. In fact, schools are focusing more on literacy. I saw a school communicating their literacy night, although I was a little bit worried about the sort of literacy that they're teaching at the school, and maybe some schools have gone a bit too low-key with their literacy, because I did see that problem as well. But regardless of that, literacy matters, but the visuals matter, and visual literacy is so important these days because we live in a world of change. We're overwhelmed by change. There's more information than ever before, so we've got to work out ways of getting cut through. And it's not just change that looks like that. I mean, such is the demographic change and technological change and social change and cultural change. We're living in a world of change that looks a little bit more like that. Now, we've got a lot of researchers in the room here who conduct a lot of research and analysis. There are 70,000 peer-reviewed journals in the world, publishing around 2 million annual peer-reviewed papers. That's a lot of research. I was surprised and disheartened to read recently that out of those 2 million annual papers, 1.6 million are never cited again by another academic. Great research, but if it's just in that long copy form with statistical tables, it's not getting cut through to the front line where the information needs to be applied to make a difference. If we bring this just to Australia, there are almost 7,000 PhD theses published here in Australia each year. A lot of work taking place, 70,000 words on average. That's 500 million words of original research being written just here in Australia. But again, I was disheartened to read that after all of that work, the average PhD is read just 4 times. And then I thought about it. I thought, well, hang on, most Australian universities have 3 people on the assessment panel. You've normally got at least 1 supervisor. You've got the candidate. I'm not sure who's not doing the reading out of that group. I'm looking at that statistic, not too sure, but you get the point. That great content, if it's not well presented, doesn't get cut through. In fact, IBM put out their big data study recently, and here's what they said. There is 2.5 quintillion bytes of data created in the world every day. In fact, they went on to say 90% of the data in the world today has been created in the last 2 years alone. We're almost doubling the amount of content in our world every 2 years. It's phenomenal, and so we've got to find ways of communicating in these changing times this important information. We don't need more information, we need applied information. We need personalised or directed information. I'm sure we've all had this experience. You know you're desperate for an answer when you have to look at the second page of Google. It's just supposed to be right there. We don't want to dig deeper and deeper, and so let's make that important information easily understood and easily communicated. We've got to look for the story in the data. We've got to do the hard work to bring our audience with us so that they can apply what we have found. You see, data it's at its best when we can interact with it, when we can see it, when we can touch it, when it's on an app or some interactive form, when it makes sense to us visually, when it's beamed on walls or buildings or on other items that we might have around so that the information gets cut through. I mean, let's give an example. We know from a healthcare perspective we've got an ageing population. Now, we could analyse this by going to the Australian Bureau of Statistics data, which of course I've done. Many of us have looked at that. But if that's where we leave the data, it's not going to get cut through for most people. There are some people that wake up each day and just enjoy getting into a good spreadsheet. They probably look a little bit like Steve Carell does here. They love Excel. But they are the minority. We've got to find broader ways of communicating. So that ageing data, I've taken it here and just communicated in simple visuals and comparing our ageing population against the growing national population. 3 decades ago, we had 16.3 million people and 1.7 million were aged over 65. But in that time, we haven't quite doubled our national population, but we've more than doubled our over 65 population, such that they have moved from 1 in 9 in the population then to 1 in 7 today. And in a decade, they'll be 1 in 6. And if we wind the clock forward 3 decades today, they'll be 1/5 of the Australian population. You see, we can tell the story visually, and by cutting down on the content, find the key angles and communicate it. I mean, think about our changing population, the cultural diversity which defines us. Again, we could grab the spreadsheets from the ABS data or other data that we might have, or we can take that and find a way of communicating it in a more consumable form. For example, the latest census data shows that more than 1 in 4 of us was born overseas. That's a higher proportion of us overseas born than is the case for residents overseas born in Canada or New Zealand or the US or the UK as well. We are very culturally diverse. And from a language perspective, we know that 1 in 5 Australians speak a language other than English at home. You bring it to New South Wales and it's 1 in 4. Bring it to this city of Sydney and it's more than half of all local residents speak a language other than English at home. And so in that environment, with more of an age range than ever, more cultural diversity than ever, again, we need to communicate in new forms. You know, some of you got one of these infographics. I did put them out there for just as an example of a bit of a takeaway for you, how to communicate. Sometimes on takeaway cards or infographic forms, visual means that might be more consumable. And so if I was to sum up this emerging generation, this new era, using 5 words, I would say that clearly we are living in a global age, and visuals will help that information spread globally. We're in a digital era, and so what's visual gets shareable, gets communicated even better than what is just in written form alone. We're in a world of social, and so it's what others are saying and sharing that matters. A world of mobility, and so people move and change and don't have the same tenure in careers, and so we've got to get people up to speed in a more efficient form. And of course, a visual world where the visuals, not just the written forms, communicate great content. And so in that environment, all the more reason to communicate visually. In fact, so visual and digital and social and connected on these devices is this next generation that safety professionals have now had to come up with new safety signs for Generation Z, like this one that I saw recently, where we've just gone out of sync here. There, they said exit building before tweeting about it. So we've got to make sure we keep it pretty relevant to the emerging generation. You know, the visual world of today, the communicating through infographics or symbols, is actually nothing new. It's in fact the oldest form of communication. Our ancient ancestors would gather around fires and tell stories. The most ancient African cave art is communicated visually. Think Egyptian hieroglyphics. It communicates through visual or symbol form. And the oldest living culture on the planet, of course, Australian Indigenous culture, where from the Kimberley they would communicate in their rock art symbols like this, and we might use a form of a male form or a female form today to distinguish the difference. They would have, for example, a bigger symbol meaning adult and a smaller symbol meaning child. And so we are not inventing infographics today. Indeed, Indigenous Australians have been using them for tens of thousands of years. In fact, they have a symbol here, again in Arnhem Land, for a kangaroo to distinguish that from their, again, rock art communicating a goanna, or in this case, an echidna, just as today in infographic form we might talk about cats or dogs or fish as well. But the point is that we've got to be able to communicate in ways that connect not just with the eyes of the head, cerebrally and analytically and, if you like, academically, but to the eyes of the heart, where it's visceral and it's visual and it's social and it's relational and it's emotional, because that's when people not only understand the information, but they will act on that information. And that is best done when we remain relevant in our communication forms. Now, even some of our old visuals might need updating for today. I found an example of this from the US. They've had a safety sign that they put at beaches and waterways for some time around water safety. Here's the sign. If you see someone drowning, it says. Now, it's a little bit out of date because that big picture in the middle, well, it was supposed to be a stick figure of someone with their arms raised, but it looks a lot like LOL. And to laugh out loud is not the right response when someone is struggling out there in the water. You can see the point. We need to remain relevant. We need to update and adjust and adapt. We need to understand the new generations and how they learn, the cultural diversity and how we can connect, and the complexity of our world, and how we can effectively and efficiently communicate content so that it moves right through our organisations, so it can be understood and acted upon. Research visualization, therefore, is research that you can see. It's research that is effectively communicated, and that is the only form of information that will be acted upon. And I hope that's useful, and I hope you can do that too. Thank you.
I'll be talking about the power of data to influence local policy and practice, and give a bit of an example there. As Mark said, data is everywhere. From the moment we wake up in the morning and check out the weather apps and see what the bus timetable's like, through to everything that happens during that day in our personal and private lives. So it is our business, whether we're an analyst or a clinician or a health service manager, we do something with it. But it's about applying meaning to that data and doing something with that data that really will make a difference. So New South Wales Health has big data already, and I'm not talking about the tsunami of work or data that's coming from the electronic medical records and the digital health revolution. I'm talking about the information that we have right here, right now, for use for health service planning, performance, and population health. We have terabytes of data on our emergency department patients and in our admissions, and we use that for our performance planning, for our health system, public health surveillance for near real time. We have linked registers holding linked data on maternal child health, sepsis, critical care, trauma that are ready to be accessed on analytics-ready platforms, and we release millions of records every year to researchers. Now, I went to the UK recently and I was fascinated by this story, which was the headline, which was Pigeon Patrol going to tackle London's air pollution problems. And I thought, wow, that's amazing. And it's about a flock of pigeons, 6 unemployed pigeons, in fact, that have been banned from Trafalgar Square. And they've got these little backpacks on, and they're going to go around and collect nitrogen dioxide produced by the city's traffic. And they tweet it to anyone who asks for a reading. So it's lots of data and it's lots in real time. But the thing is, I thought, well, so what? Just because you've got that data and just because it's real time, unless you're actually engaging with the Greater London Council or looking at the source of emissions and doing something about it, that information's not that useful. Interesting story though, and it does raise profile. And the data that we have in the health system, we know has a number of challenges, and unless we understand the context in the way that that data is collected, or the way our actual health system works, which is pretty important, or variation in codings, clinical interpretation, unless we know that and think about that, we can quite easily come up with an answer that's clear and simple, but wrong. And here's one example. It's an ecological study, not quite a study, but take this example that shows that, increased cheese consumption can lead to increased deaths from people becoming tangled in their bed sheets. Now, that's not that useful, because if something doesn't make sense when you look at the stats, perhaps it actually doesn't make sense, and you need to think about the stats and critically appraise them. And critical appraisal is a key part of being data literate. We all like to think of ourselves as literate, but we need to be data literate. And even if you're a great analyst and can understand the stats, you still then have to have the meaningful interpretation, and that requires partnerships. Now, the best partnerships that we have are those that have been built over many years, and they include the community, they include clinicians, system managers and coders, epidemiologists, etc. And most importantly, those who can make changes to the health system itself. And even if we've understood the data, we've interpreted it, and we've understood what it means, unless we do something about it, unless we change it into policy and practice, then again, it's not a good use of health system resources. In the research space, we have a translation model where we talk about translating research into practice. I believe that we need to have that model with data. It's about doing something with the data. Now, I'm going to give a local example here about how data was used and partnerships were used to drive program redesign. So in 2016, the New South Wales HIV strategy was released, and the concept of this is focusing on testing, treating early and preventing. And underpinning all of this is the concept of collaboration, partnerships with the community and the clinicians and the frontline service providers and the ministry, built on many, many years of working together, and that's a critical part of this story. And to complement this strategy was a well-developed monitoring and evaluation framework which was providing quarterly reports to look at what's happening. It was very well received. A number of people are here in the audience, all actively participating. And And then PrEP came along, which, as you know, is a prevention treatment which, through one pill once a day, provided to people who are at the highest risk of getting HIV, can actually prevent transmission. And we are now looking at ending HIV. So to roll this out, the EPIC study was implemented across New South Wales, a collaborative implementation trial which commenced in March 2016. And by May 2016, over 1,000 people were enrolled in the trial, and things were going well. But then the stats came in that sort of showed that by the end of 2016, the end of quarter 2016, we were still seeing an increase in acute infections. So what was going wrong? So the way to unpack this was to get the expert data group together to actually discuss and think about, well, let's look at the clinical notes. Is our strategy targeting the right people? Are we actually looking at addressing the right people and giving the right PrEP to them? So the response was a review of the clinical notes, and it was with the community, it was with the clinicians, and it was with the Kirby Institute. And the Kirby then revised their estimates by increasing the number of people who had to be on the trial from 3,700 people to 9,500. The sexual health clinic directors changed their recruitment strategy and put that into practice. So by 12th of March this year, we had over 5,000 people enrolled in the study across New South Wales, and we're seeing really positive signs. And I think it's a very simple way of saying, building on all of those years and experience and looking at the data itself. So I'm now going to sort of wrap up this session about talking about some of the innovations that are coming in this space, in the analytics space. We know that we have a lot of data. I talked about it before. It's residing in lots of different parts of our complex health organisation, and we're wanting to look at ways to be able to ensure that people have access to that. So at the moment we're building the Data Analytics Navigator, which is being built to ensure that everyone in the health system will have a single point of entry to access and navigate to all of the open data that we have, the aggregate data that we have, and the unit record file data that we have. This isn't an EMR, but it is to be used for system planning, performance, and research, and it will be a single point. And in there will be all of our resources as well, training, interpretation, and a range of other opportunities. Now, the second one is about enhanced record linkage. So we're currently getting more and more access to MBS, PBS data after many years, and that's been fantastic. And we've also been working with Ray Messam and his team to look at linking the GB data in Western Sydney. There's also a lot of activity in the cross-agency data space. So recently, as you know, there was the Tune review of the out-of-home care. And this review highlighted the need to identify families and children who have the poorest outcomes so that we can target interventions. So what we did with the Centre for Health Record Linkage was link data from facts, justice, education, healthcare data to be able to provide that mapping, to look at that client journey. And the Data Analytics Centre at DFSI has been involved in actually turning that data into something meaningful. We're also providing new assets to help surface some of those data that we have, as well as being able to provide even more data to you. And one of the assets I'd like to talk about is the New South Wales Biobank, which will open shortly at the RPA Camperdown. And the aim for this is to support world-class research and be able to store up to 3 million human biospecimens using large-scale robotic technology. But of particular interest to me, working in the population health space, is the collection of biospecimens from the 45 and up study. And this will be linked to as part of the New South Wales Population Biobank. Now, the 45 and up study, 260,000 people, data's already linked to the MBS and PBS and all of the health administrative data. Soon we'll be able to have biospecimens on this group, and that will make that a unique and valuable resource for New South Wales. So To conclude, data is everywhere, and data is what we do every day, but it's what we do with it that counts. Thank you.